Education Series, Module 5, Oral Diseases and Conditions, Part 1. My name is Dr. Brecky, and I'm here with Ready, Set, Smile, ready to talk about some of the most commonly experienced diseases and conditions in the oral health and dental care fields. So, Module 5 is a brief review outlining some of the more common oral health conditions. Just remember, this is not a comprehensive list. Material is subject to copyright by Ready, Set, Smile and Dr. Brecky. Developing positive oral health habits and a stable hygiene routine are essential in the prevention of oral diseases. Remember, oral diseases have systemic or full body effects. So let's briefly review oral anatomy. The oral cavity includes the lips, the teeth, the gums, the tongue, the soft and hard palates or roof of the mouth, the floor of the mouth underneath the tongue, the throat, the bones of the oral cavity including the maxilla and the mandible, and the temporomandibular joint or jaw joint. The periodontia describes the surrounding soft tissues or gums and also the hard tissues supporting bones of the teeth. Now, in this module, we will review commonly experienced diseases and conditions of the oral cavity, their processes, their risk factors, and also treatments. So, oral anatomy of the mouth. Again, this includes the lips, the gums, as you can see, the uvula on the, back towards the throat, as well as all of the different types of teeth. So, and again, the anatomy of a tooth, which includes the crown above the gums, which is enclosed in the hardest structure called enamel. Underneath, there's the also pretty hard structure called dentin, but it's softer like bone, and it just covers those, live tissues and blood vessels and nerves that reside within the pulp of the tooth or the inner tooth structure. The cementum is the tooth structure underneath the gums, and the periodontal ligament is the cushion that the tooth sits within the bone comfortably. So here's just a nice little diagram, and you can see lower, underneath the tooth is the supporting bone. Very important. So common oral conditions that we will discuss today include dental caries, which we've gone over in a previous lecture, periodontal disease, xerostomia or dry mouth, tobacco use and abuse, oral cancer, candidiasis or yeast infections, halitosis, bad breath, bruxism, which is grinding and clenching, and trauma. And this will be broken down into 2 separate modules. So oral diseases and conditions, part 1. Today we are going to review dental caries, periodontal disease, xerostomia, and tobacco use and abuse. So dental caries. Haven't we already had an entire lecture devoted to dental caries? Yes, but again, it's one of the most commonly experienced diseases in the entire world. So it's important. And they say, repetition is the father of learning. Dental caries, a review. So this is commonly known as tooth decay or cavities. It is the #1 chronic disease among children and also the #1 infectious disease among children. It's a big problem. It is 5 times more common than childhood asthma. It's a multifactorial disease process which occurs when acid-producing bacteria feed on sugars and foods in the oral environment, and those acids break down our teeth and our dentition. The breakdown of that dentition can lead to infection, which can spread systemically. So severe dental caries can be a life-threatening emergency, and this is exactly why it is so important to educate others about this disease. So a brief review of the caries process. As you can see, there's a healthy tooth with plaque. When that plaque becomes colonized with bacteria, it turns into a little bit of decay in the enamel. And at this point, this is actually a reversible condition if you were to use fluoride, which I know that you know all about since we've already gone over a lecture in fluoride. Now, if the decay is left untreated or fluoride is not used to take care of it, it permeates into the dentin of the tooth or the inner tooth structure, and that's when intervention is necessary. Fourth, it can lead to reaching the pulp of the tooth, which can manifest as severe pain, swelling, infection, and sometimes systemic infection. And again, the three big entities that are all necessary and sufficient to fuel the caries process include the oral environment, the sugar substrate, and the bacteria that feeds on the sugars within this environment to break down the teeth. All of these processes occur within time and the frequency at which we eat foods, which are also very important factors here. So, that was a brief review, but the next thing we need to talk about is periodontal disease. Now, this could be an entire lecture itself because periodontal disease describes a host of many different diseases that affect the supporting tissues of the teeth, the gums, and the bone. So multiple gum diseases exist, and these include things like ulcers, gingivitis, periodontitis, pregnancy gingivitis, recession, viral-related gingival lesions, malnutrition, disease-related gum diseases, gingival overgrowth, issues like that. There are many different things that can happen within the gums, and they are all included in an umbrella term called periodontal diseases. Now, when we normally talk about periodontal disease, we're talking about a process that includes gingivitis and also periodontitis. So if you've ever heard of gingivitis, gingivitis is a reversible disease process in which the gingival tissues surrounding teeth become inflamed and irritated in the presence of foreign bacteria. Do you remember the biofilm and the pellicle and the plaque? Those are what stimulate gingivitis. Now, periodontitis is a much more severe form that happens when gingivitis is left untreated. And it's an irreversible disease process in which chronic inflammation has resulted in a loss of supporting structures of the teeth. This chronic inflammation causes the gums to grow away from the tooth structure, which in turn causes the bone to grow away from the tooth structure. And that's the process of periodontitis, which also, left untreated, can even lead to tooth loss. So most adults have some form of periodontal disease. That's right, from gingivitis to periodontitis. It's all of us, even those of us who take really great care of our teeth and our gums. 5% of the population has severe periodontal disease. Now, just keep in mind, the prevalence of periodontal disease is rising because adults are maintaining their dentition and their teeth for longer spans during a life course. But also, people are living longer. So that means the burden of periodontal disease is increasing. And just remember, those without teeth, which we call edentulous people, are not suffering from periodontal disease. So that can affect the numbers when we're talking about percentages of adults with these diseases. Almost 20% of adults over age 65 are edentulous or have no teeth. That's 1 in 5. That's a lot. So let's just take a moment to review the pathway for developing periodontal disease. As we've discussed before, the first thing, after not brushing for minutes to hours, a biofilm develops on our teeth. It's a complex film of bacteria that adheres to the hard tooth structure in the presence of water, or in our case, saliva in the oral environment. What happens to that biofilm? Well, it starts to collect gunk and debris and things like bacteria, which in turn causes a plaque to form. Plaque is the white gunky stuff that you can see. It's visible intraorally and wipeable. What happens when the plaque is present on the tooth? Inflammation of the surrounding gum tissues begins. And that's just because anytime there's something foreign sitting on your tooth and sitting on your gums, they are angry and they don't like that. So inflammation, our reaction to invaders, begins. If left untreated, the plaque tends to collect gunk, it collects fluoride, it collects debris, it collects foods, and a calculus hardens. Over time, this mineralizes, and like I said, that's why it's called calculus. It's a very hard structure, and it most commonly accumulates on the lower back of the lower front teeth. Inflammation of the gums, in this case, worsens because that is a much stronger foreign invader to fight against for the gum tissues. And what happens is they start growing slowly away from that tooth process because they're angry and upset. Lastly, chronic inflammation persists if this calculus and this debris is not wiped away. There's viruses, there's bacteria, there's a lot of things within that plaque and within that calculus. And it affects the surrounding tissues. It can cause destruction of the bone over time, and that's what causes the strong supporting bone to grow away from the teeth slowly with time, which can actually cause the tooth to become ultimately loose. So as you can see, this is a spectrum from gingivitis to periodontitis, and intervention is key. So the stages of periodontal disease. In the upper left, we have a healthy tooth. In the second slide, we have a small accumulation of plaque and debris, and a little bit of red unhappiness in those gums. That is gingivitis. That is reversible. As we move down into the lower panels, panel 3, periodontal pockets begin to form. And you can see what that means is the degradation or breakdown of those gum tissues. They're unhappy, and that's when they just start growing away from that tooth a little bit. In the fourth column, we see periodontitis, which is not only the degradation and pulling back of those gums, but it's the degradation and pulling away of the bone. These are both irreversible processes in the bottom columns, but you can see once that bone is lost, it is very difficult to ever improve the bone level on that tooth. And that's when, drastic intervention is very, very important and necessary. So what are some risk factors for gum disease? Well, 1, poor oral hygiene, lack of visiting a dentist, but also things like tobacco use and substance abuse, poor systemic health, diabetes, other, medical problems cause gum disease to arise, pregnancy, braces or oral appliances causing other stuff to accumulate in the mouth. Medications can increase the susceptibility to periodontal disease. Age, even just the anatomy of your teeth. Are they super crowded or rotated? And is that causing things to get stuck more easily and lead to periodontal disease? And lastly, genetics. These are all factors for periodontal disease. So treatment for gum disease, as you can see, we've listed here on the spectrum from gingivitis to periodontitis, we have simply brushing. Yep, brushing your gums and your tongue and your teeth at least twice daily. Flossing and mouth rinses. Consider using a water pick, especially if you have bridges or things like that that are difficult to clean underneath. And a professional cleaning every 6 months. As gingivitis turns into something like periodontitis, we think about professional deep cleanings called scaling and root planing, and also more frequent visits to the dentist for every 3 to 4 months rather than every 6 months. If periodontal issues become problematic, then periodontal surgeries are something to consider, which can help with this attachments of the bone and the gums to the teeth. But in some cases, tooth extraction is necessary. Just remember, prevention is key. Xerostomia is another very common condition. What is xerostomia? It's dry mouth. And it's actually a very uncomfortable and oddly common condition experienced by children and mostly adults. The prevalence remains controversial. Estimates range from 5.5% of the population to almost 50% of the population. Signs and symptoms include polydipsia, or drinking excess water, difficulty swallowing or speaking, altered taste or hypersensitivity to things like spices, or difficulty wearing dentures. So something that will make your mouth water, saliva. Again, the lack of saliva flow is a major risk factor for a host of oral diseases and conditions. And xerostomia, dry mouth, is describing a lack of saliva. So risk factors for dry mouth include taking many medications, especially antihistamines, antidepressants, decongestants, diuretics. There's over 400 commonly prescribed drugs that actually cause dry mouth. Age. Older adults often experience dry mouth because the salivary glands tend to break down over time. Radiation to salivary glands, such as in cases of head and neck cancer, mouth breathing at night, stress and anxiety, tobacco use, marijuana use, substance use and abuse, trauma to facial nerves, or systemic health conditions, including depression, diabetes, HIV and AIDS, Parkinson's, Sjogren's syndrome, thyroid diseases, dehydration, other autoimmune conditions. This is not a comprehensive list, but dry mouth can affect a lot of different people, and it can really drastically reduce quality of life. So what are some treatments for dry mouth? Well, of course, increased intake of water and fluids is very important, but avoiding trigger foods like caffeine or spicy foods for those who are affected is key. Discontinuing or altering medications only when feasible is also an option. So please talk to your doctor if your medication is causing severe dry mouth that's affecting your ability to speak and eat and communicate with others. Avoiding tobacco and alcohol are key ways to reduce the burden of dry mouth. And also consider mouth rinses, such as those created specifically for for dry mouth, like Biotene is a brand. And avoiding those with alcohol is actually a really important way to reduce the burden of dry mouth. Lastly, try stimulating salivary flow. Consider sucking on sugar-free candies or lozenges, or consider sugar-free gum. Again, note sugar-free. And lastly, there are some medications to treat dry mouth, but please speak with your physician or dentist before attempting these medications. Lastly, tobacco use and abuse. Are we still talking about this? Yes, this is still a huge problem in the US today. Whether you're a smoker, or you know a smoker, or you don't know anyone who's a smoker because you didn't think that anybody smoked anymore, there are a lot of people in the United States still smoking tobacco. So 1 in 5 deaths in the US are attributed to tobacco use. It is the leading cause of preventable death, disability, and disease in the US today. So in 2017, 14% of Americans smoked cigarettes, and that is down from 20% in 2005. There was $170 billion spent each year in treating tobacco-related diseases and conditions. And just remember, some of those are your taxpayer dollars. Tobacco contains an addictive substance called nicotine, which is one of the most addictive substances in the entire world. That means breaking that habit, very difficult. So let's take a look at tobacco use and abuse data from 2017 in the United States. As you can see, this is still predominantly the most common in the southeastern United States, and in the southern states, but it's still a very high percentage. So, vaping. This includes THC or nicotine-containing battery-operated devices which allow the inhalation of aerosols. Vaping or e-cigarettes has caused a drastic increase in our younger generations of previous non-smokers starting up smoking again. Not only has it caused that, but it's caused a huge increase in associated health problems. I am sure that you have heard about vaping in the last 6 months on any news or media source. Have you ever heard of popcorn lung? It is a problem, a side effect occurring within young, healthy adults who have vaped products. Another term is EVALI, and that is what describes the mysterious lung diseases related to vaping and also the use of e-cigarettes in the US. So just know that this is something that's happening to our youngest generations, and it is a huge, huge problem in the public health sphere, and something that we really want to educate others about, because we want to prevent our kids from going down this path of falling into the vaping issue. So what are some effects on oral health of smoking? Gum disease is like number one. Xerostomia, dry mouth, halitosis, bad breath, staining of the dentition, even an impaired sense of taste and even smell. It could definitely causes poor or delayed healing and worse surgical outcomes for any kind of dental-related issue. And even worse, it leads to cancers and it leads to death. So what are some risk factors? Well, age is certainly one of them. Our obviously younger generations and those born in the baby boomer generation are more likely to smoke. Gender, sexual orientation, substance use, or history of abuse of substances, mental health disorders, racial or ethnic disparities, military service, disability status, education level, socioeconomic status. These are all risk factors for smoking, especially tobacco products. So what are some treatments that people can pursue to stop smoking, which is something we call tobacco cessation? It typically takes 9 attempts to quit smoking, and it is a very difficult thing to do. On one branch, there's pharmacotherapy, or things a person can take to help stop smoking. And this includes nicotine replacement therapy, which is available over the counter, such as nicotine gum, nicotine lozenges, or the nicotine patch. Other things you can, also seek from your physician or your dentist to aid with smoking cessation. And then there's also combination therapy. And on the other end, that also includes behavioral therapy. So seeing a therapist. Cognitive behavioral therapy is huge in helping smokers to stop smoking. Motivational interviewing, which is something that we'll actually talk about in one of the upcoming modules. Mindfulness, and also technology-based support. Yes, there is an app for that. And sometimes you can even pay yourself. Is it really worth your life? Well, how about the person next to you? Help to get this point across, especially to the younger generation, where vaping is now becoming a big concern. Oral diseases share many risk factors with other systemic, whole-body health problems. And just know these oral diseases can be detrimental to overall health and quality of life. Thank you to our sponsors. We will see you next time. Thanks for joining.